Hi, good afternoon, everyone, and welcome to our webinar. Next slide, please. Welcome to today's webinar. This is New Jersey's Comprehensive School Mental Health webinar series, and this is session 2 on needs assessment and resource mapping. Next slide, please. Next slide, please. On your screen, you will see a schedule of our upcoming webinars in this webinar series. They're being held monthly, and we will share a link to the website where you can register for all of these webinars at your convenience. Next slide, please. And in addition to our monthly webinars, we are also hosting our New Jersey School-Based Technical Assistance calls. In the website that I will share in the chat box, you will see also the available openings for our technical assistance calls, so you can register for those and meet with our team. Next slide, please. So a little bit about us. We are, the MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. We ask that you please visit the MHTTC Network website for additional information at mhttcnetwork.org. Next slide, please. On your screen, you will see a map of our regions. We are Region 2, and we serve New York, New Jersey, the Virgin Islands, the U.S. Virgin Islands, and Puerto Rico. Next slide, please. We also have supplemental funding that was awarded to us to provide training and technical assistance to teachers and school staff regarding school mental health. And our focus is on the importance of mental health supports in schools, to build capacity and to recognize and identify mental health concerns in students, to utilize best models of school-based mental health services, and linking as needed to community-based services. Next slide, please. And on your screen, you will also see the areas in which areas of focus that we have. Next slide, please. And if you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, please sign up to receive our email communications. We will share the bit.ly link that is on the screen in the chat box. Slide, please. Following the webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future activities. The surveys are also important because our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. Slide, please. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint presentation in the next few days. Next slide, please. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Please do not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Center. And this presentation will be recorded and posted on our website. At the time of this presentation, Miriam Delphin-Rittman served as Assistant Secretary for the Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your question as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenters may pose questions to you. So please use the chat feature to answer those questions. Next slide. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. This includes language that is strength-based and hopeful, language that is inclusive and accepting of diverse cultures, genders, perspectives, and experiences, language that is healing-centered and trauma-responsive, that invites individuals to participate in their own recovery journey language that is person first and free of labels, non-judgmental and avoids assumptions, and that is respectful, clear, and understandable and consistent with our actions, policies, and products. Next slide. Now let's begin our webinar. We have Dr. Ahmad Zahir and Ms. Angela Dunbar with us today. Dr. Zahir is a pediatric school psychologist and has worked on numerous projects in clinics, hospitals, and public and alternative school settings that involve direct and indirect consultation services across individual, group classrooms, and systems level. His areas of interest are in developing assessments and interventions for students with emotional and behavioral challenges and creating comprehensive school-based prevention programs by integrating school mental health, social emotional learning, and school-wide positive behavioral interventions and supports. For his work in these areas, Dr. Zahir was awarded the Council for Exceptional Children's Professional Performance Award in 2019. Dr. Zahir is the co-founder of the Nurturing Environments Institute, also known as NEI. Ms. Angela Dunbar is the assistant principal of the Halstead Middle School and Director of Curriculum and Professional Development for Newton Public Schools in Newton, New Jersey. Angela has over 17 years of experience in education. Prior to becoming a school leader, Ms. Dunbar was a high school special education teacher for 8 years in Newton and 5 years in the Bronx, New York. Ms. Dunbar believes in providing educators with individualized support in order to build their capacity and increase student achievement. She is the founder and leader of the Curriculum Consortium of Sussex County and organizes professional development opportunities for educators in Northwest New Jersey. Ms. Dunbar's administration prowess was recognized when she received the 2017 Dale Reinhardt Excellence in Education Award for her work as a leader in the area of curriculum development and her ability to provide professional development opportunities for educators. Additionally, she was a recipient of the Newton High School Teacher of the Year Award in 2014. She holds a master's in school building leadership from Columbia University. I want to welcome everyone once again, and I will turn it over to our presenters.
Okay, so I'll get started on our needs assessments and resource mapping, the topic for today, but I just wanted to start off by saying thank you to Rutgers and MHTTC for inviting me to do this presentation. And it's an area that I think is actually very critical to our success when we're looking at our school mental health process, but often doesn't get as much attention. So I'm very excited to be able to present on this today. So as our very brief agenda, I'm going to actually start off with a very quick review of multi-tiered systems of support and introduce or maybe review as well the interconnected systems framework, just to get us back into the mindset of what we were doing when we're thinking about school-wide mental health. And then I'm going to go into our needs assessments and resource mapping and some steps of what we do and why we're doing this process. So I always like to start off by mentioning, especially for MTSS, the multi-tier systems of support, that it's not a program or an initiative that we're doing in schools. We have a lot of those that we're often familiar with, but it's really a framework that we're going to be using as a way to enhance our adoption and implementation of a continuum of evidence-based interventions to achieve both academic and behaviorally important outcomes for everyone. Right, all individuals that are served by our system. More recently, I think there's been an increased attention towards including adults and professionals as part of the system as well, of thinking about our adult mental health and well-being. So it's really a framework for implementation that's really helping us create a system that's going to meet all of our needs, whether they're very intensive needs or general needs that also need to be met. So usually this is seen as the triangle model, where we're looking at the base level, how do we promote healthy outcomes for everyone, as well as prevent challenges for everybody. But it's also multi-tiered in the sense that for some individuals, we're going to need to add in a little bit more extra supports. And for a few individuals, we'll need to add in even more supports at a more individual intensified level. But we want to do this in a way that's going to be based off of our data. So we want to collect data on how well we're doing as a whole school, as a community, and then look to see what levels of supports each individual needs. And our real task here is to make sure we're matching the appropriate level of supports based off of appropriate levels of need. So I always like to give two cautions here. One of them is to keep in mind that when we're thinking about any of our school mental health systems within this MTSS framework, that we're really focused on how we organize our supports and not categorizing children with a new categories. So it's not, there's a green child, yellow child, red child, but really looking at even an individual child like Malcolm here and realizing that for a lot of his needs and even his strengths, we're helping him at the universal level in the green area. But for areas that Malcolm might struggle with a little bit more, we're providing him with some problem solving supports, as well as maybe even trauma focused cognitive behavioral therapy if he has a history of trauma in his life. But we're doing this all at the same time, right? We're providing this continuum of support for Malcolm. And that's really what the model is, at least ideally aiming for in terms of what we're creating. So this actually leads us to the idea that the MTSS model is layered, and we often miss this when we're looking at the 2D image. So here's a 3D version of it, where we really want to make sure that if we're adding in the targeted or even intensive supports, we're adding them really on top of the universal. And if we're doing the intensive, we're adding that even on top of the targeted supports. So we're not deleting or removing, but we're adding more and more supports for the students that need it. So this brings us into our topic for today when we're thinking about our needs. One thing that I also like to consider is that mental health itself is a very broad area. And there might be some of the more classic things that we think about with mental health, like our anxiety and depression, that might fall into more of these negative indicators. But we can really look at this around across this whole graphic here, where this might also include things like trauma, externalizing problems with rule violations, but also things like our positive indicators in terms of life satisfaction, social emotional skills, strong relationships. So when we're thinking about our school systems and our school mental health systems, we can really take stock of what are our needs across both of these positive indicators as well as some of these negative indicators. And once we're looking to match our needs to our resources, when we look at our MTSS models for school mental health, we also can recognize that there's many different ways of approaching those different needs. So typically in schools, we have multiple initiatives that use the MTSS framework. We have SEL, or social emotional learning, which often focuses more on those positive indicators, really building strong social emotional connections, as well as different skills and improving life satisfaction. We have our mental health systems, which is a little bit more focused on our traditional psychiatric concerns, a lot of anxiety and depression, or internalizing issues. And then we also have initiatives like positive behavioral interventions and supports that tend to focus more on externalizing challenges, so children with attention issues or behavioral challenges, as well as looking at our broader school culture and climate. So depending on our needs, we might be doing one or all of these, or even picking and choosing which resources are going to match the needs that we have within our school setting. And we can also take this one step further, where we can look to take the MTSS model and ask if we can use the same framework to also include and partner with our families and help not only the family, but also involve the family in helping the students. So we're using a tiered model here. We can think about at the universal level, how are we including all of our families? Do we have a family resource center? Do we have materials for our families? Are we doing screenings that involve our family members as well? And then we can do the exact same thing we would within our school systems, where for some families, we might be able to provide more intensive supports or more involved partnerships based on their needs. And so when we take this model of MTSS and extend it to our families as well as other systems, this is where we get the interconnected systems framework. And this is really an extension of MTSS, but really recognizing that based on the needs that we have, schools are not going to be necessarily alone in addressing all of them. And in reality, as schools, we're often limited in terms of addressing every single concern that comes across our table, but we want to be able to partner with others that allow us to better meet the needs of our students. So one way to visually demonstrate this is looking at a graphic like this that highlights not only that the youth is embedded within the family and community and culture, but we also have a whole host of different settings and services that are going to help individuals. And across all these settings and services, there's a continuum of support that we can really create for individuals. If we're looking at just the school piece and looking at our multi-tiered system, we can see we actually cover quite a bit here, right? We actually cover almost half of the circle of continuum of supports. And this will be all of our different MTSS initiatives, but there's still a lot here that's missing, right? There's other things that might be needed. So within interconnected systems framework, we really try to include all of the different organizations that might be relevant for us, including home as well as many community agencies. So we can actually fill out the full continuum of supports. So when we're doing this work and this extension of MTSS, we can really think about how do we do cross-setting partnerships if we recognize there's needs that we need to partner with others to be able to meet them. Okay, so that was, again, just a very quick review and refresher on MTSS and interconnected systems framework. So if we start to think about our specific system and we're moving towards school mental health, the two things that we really want to focus on as we're starting is one, thinking about what our needs are, and do we actually know what those are? And if we don't, do we need to do any additional assessments to figure that out? And the other piece is to recognize or get a sense of what resources we currently have that are meeting those needs, as well as what resources we need to meet the needs. So if we're looking at these two things together, that's really going to guide our action plan. So all the other steps that we have to take as part of our school mental health initiative or using the MTSS framework is really going to be guided by what our needs are, as well as what resources we currently have and may need to add into the future. Yep. So just going a little bit more detailed into the needs assessment, this is a process that is team-based. So everything in MTSS is based off of having a representative team. And if we're working with our community members, we want to make sure we include them. And then we want to engage in a process of really determining what our needs are. This can start off by looking at existing data that already tells us there's problems, or we can go out and collect more data to figure out what specific areas we need to address. And we can do this, by existing measures that we already collect in schools, or even using specialized mental health tools that have been created, where we can do universal screenings to figure out what all the needs are for our students and families. I always like to highlight the role of teams in this process, just to highlight the importance of the implementation process, that our teams are really going to be important to do the needs assessment and resource mapping, as well as carrying forward with the action plan. And there's a lot of research showing that if we do this work, we actually make a lot more progress in 3 years, about 80% implementation compared to 14% implementation over a 17-year period. So teams become essential. There's a lot of different steps that teams are involved in. And specifically for our purposes today, the needs assessment and resource mapping are critical steps in this process. So as I mentioned earlier, when we're looking at our needs assessment, a lot of this work can be done based off of already existing data. And this is often our discipline data, our surveys, our grades, our attendance. And there's a lot of information that's already often present in schools. I actually had a school once, a high school, that initially consulted with us because they were worried about their students who were checking their grades thousands and thousands of times after a test. So they had an online system where their grades would be posted, and they would find that their students were checking hundreds and thousands of times. They were checking in the middle of the night. And that was actually existing data that first cued them into that there was a very serious mental health concern that they had for their students. So we want to start off with that existing data that tells us there's a problem, but we also want to extend beyond that to also make sure that we're not missing any information out there for needs that we might not necessarily be aware of. So we can do additional assessments to figure out what those needs are. And if we're doing those additional assessments, there's often some categories that we can focus on. There's risk factors, things like exposure to stressful events or adverse childhood events that can help us identify individuals that already might be at risk. And we can also look on the positive side of protective and resilience factors. Are there things that we're seeing that are going to help individuals and really be a source for helping build resources around to support those students? Even more broadly, we can think about all the different types of needs and if they're being met for our students and families, everything from basic needs, food, shelter, and safety to physical need, psychological, mental health need, social needs, academic needs, or even just general activities of living, hobbies, art, religion. And depending on the scope of our project and what we're doing, we can look at all of these or target some of these, but this could be part of our additional data collection. And there's two key functions here that we want to address when we're looking at our data. The first one is really just to not only identify our need, but also identify what level of need it is. So if we're thinking of our multi-tiered systems, we want to know what are the needs that we can address universally, as well as what are some needs that we might need more advanced tiered supports at tier 2 and tier 3. And if we can even do this upfront, we have a better chance of helping students early, as well as collecting resources that are going to be helpful. The other function here is baseline. So if we're doing any kind of initiative like this, it's a lot of work, and we want to make sure that as we're doing this, that we actually reach our goals. So the initial needs assessments will also help us figure out what our starting point is. And if we're putting in any kind of specific strategy in place, we can look at our baseline to figure out if we're actually seeing improvements in our program. And this will be important because we can even pick a really good program, but it might not be meeting the needs of our students in our particular building. So having this baseline will help us guide our future progress. So there's also wonderful tools out there that can help do some of these further assessments. And here I've just listed 4 that I have used and like. All 4 of them actually have really good research. And even equally importantly, they're ones that I've used a lot in schools, and school professionals have given good feedback on. They're often very, very brief to give and give us a very broad picture of different concerns that might exist within the school building, and also give us functional information. So they're not just telling us what the needs of the student are, but they often also help us figure out what our next steps are. What specific resources do we need to connect the students to in order for them to be successful? So once we've collected this information, we want to make sure that we are able to differentiate it, again, based off the level of need. So, what are the needs that can be addressed at tier 1 for all students? What are the tier 2 level needs, as well as the tier 3 needs? And every school system will have some level of continuum. Your numbers might look slightly different, but we want to be able to grade our needs across this continuum in order to help us better meet the needs in terms of our resources. We could even take this one step further, and depending on how much we're collaborating with our home and families, as well as our broader community members, and do a needs assessment across all these different settings. And again, grade them based off of the universal all the way down to individualized supports, and look to see how we can meet all those needs. So that's the first part here of thinking about our needs assessment. The second part is our resource map. And this is going to be really looking to see, now that we know what our needs are, how do we tie that into the resources that we have? So when we're looking at our resource mapping, it's usually a guided process. So if we already know what our needs are, we want to also move towards our goals and purposes. And the first step in this is often just listing all the resources we currently have that's related to our goals. And once we've listed these, we can compare them to our needs and actually identify some gaps. So are we seeing any need that's very present and one that we need to address, but there's no resource that we currently have that's going to address that need? And once we've collected all this information, we can use that to create a new resource map that's going to better meet the needs of the students that we're working with. This also involves not just looking at our resources and adding, but also how can we better align and integrate our resources. Oftentimes we have multiple resources for the same need and no resources for another need. So we can often reorganize to help us even save money as we're doing these initiatives, and also even plan for what we're going to need if we're thinking about our our future project, how much money and funding do we need for the next 3 years. So it can also help us as part of the planning process and reorganizing existing resources. But there's a lot of different things that we can look at when we think about these resources. And this is where it's going to connect back to our interconnected systems framework. A lot of these resources are school-based, obviously school-based mental health services, tutoring, mentoring. But a lot of these are also things that are not going to be in the school setting. So, urgent care facilities, hospitals, group therapy even. So we really want to make sure that we have a broader list of resources, not just in the school, but also in the surrounding community. And again, look to see if we can match it to the needs for our students. So a lot of the resource mapping manuals out there are really good in guiding this process. So we can even do a resource map of inside our school as well as outside of our school, and actually list these out based on what person or position is available to meet a specific need. We can ask what that person does, when they're available, what's the best way to reach them, and who they're going to serve, or what specific need are they addressing. And this can really help us visualize and create our overall map to understand what exactly our resources are used to address in terms of mental health supports. And our final process in this is going to be really focused on, again, creating that map, both in terms of our school-based resources as well as our community-based resources. And once we have this list, we can start to move to our final step in this process is to figure out where those gaps are. So if we are looking at this across tiers as well as across our school, home, and community settings, we can list out all of our needs as well as if there's resources to address them. And if we see blanks here, right, there's a need, but there's no resource, we can actually tie that into our last step here, which is our action plan, right? So our future plans are going to focus on how do we fill those gaps? How do we make sure that we're able to meet those needs based off of what we learned with our needs assessment as well as our resource mapping. So I'm going to stop here because action planning will continue into the future webinars as well, but that was just a very, very quick overview of the needs assessment and resource mapping. And I'm going to hand it over to Ms. Dunbar to give us a case example.
Hi, thank you, Dr. Zaire. Right now, I'm going to share my screen, and so we can continue with the presentation. Thank you, and we're going to transition now to hearing from Ms. Angela Dunbar, representing Newton Public Schools and our New Jersey District Exemplar, describing their experiences with needs assessment and resource mapping. Thank you, Ms. Dunbar.
Right, so good afternoon, everyone, and thank you to all the educators that are here for taking the time out to join us today. I know that we're in a situation now in which many of you may not have a lot of staff members, and it's a difficult time coming back from a year of a pandemic. So next slide.
Excuse me.
So I just want to give you a little background, or just, I should say, information about our school district. We have grades pre-K to 12, and we have 3 schools, at elementary school, middle school, and high school. Our total current enrollment to date is 1,611 students. Our elementary school and middle school receive Title I funds, and our high school is a receiving district at the high school level, and we receive students from Andover and Greene. Next slide. So these are our district goals for 2021 to 2024. And I felt this is great to show you our areas of focus for our district. Our goals focus on the social emotional support for our students, as well as mental health, building a culture and climate of belonging and dignity, and meeting the needs of all of our students academically and socially. Next slide. So this is an example of our MTSS framework. This particular example is an example from the middle school, and this is our Tier 1 interventions. We are practicing positive behavior and support as our Tier 1 intervention. We have partnered with NJ, New Jersey PBIS, and we received support from them in developing all of our behavioral interventions at the Tier 1, Tier 2, and Tier 3 level. And tier 2 is our check in, check out for students who require additional adult attention. We have some students that exhibit needs for additional attention within the classroom or outside of the classroom. So that is an intervention that we provide at a tier 2 level. We have group counseling sessions that are provided by outside community partners that come into our school and provide these group counseling sessions for our students. We have school-based interventions, and we have community mental health at our tier 2 level. So we also have outside providers as therapists. We have a community schools room and areas within our middle school and high school in which counselors come in order to provide our students with one-on-one counseling. Tier 3 is more of an area in which we have outside providers providing interventions, is a more intensified intervention and support. And we usually refer students to outside counseling for mental health, drug and alcohol, maybe DCP&P referrals. And then we also have our function-based problem solving that is addressed by our intervention team. Next slide. So now I'm going to talk about our procedures for resource mapping. So this resource mapping process occurred between the elementary school, middle school, and high school. So it was a district process. And our superintendent also led it with myself and Ann Murphy from Rutgers MHTTC Center. Next slide. So step 1 was our pre-planning process. So the first thing we did is to assemble all of our team members within our district. So we made sure that we had representation from each and every single school. We had our district superintendent, all of the administrators from the elementary, middle school, and high school, our social workers, and our guidance counselors. So that was integral to ensure that we were all on the same page and we're all receiving the same information as well as hearing the same information. We identified our resource mapping objectives, and then we decided that we would all sit down and ensure that we provide a consultation session for all of us, and ensure that when we leave our meetings, when we go back to our schools, we're also relating the same information or gathering the same information from all of our staff members in order to help us to create our resource map. We scheduled meetings in order to create the resource map. There were 3 one-hour team meetings that include everyone on our team. And then we had individual school meetings. So it totaled to be around 9 hours in order to get our resource map completed. Next slide. And step 2 was our mapping resources. So what we did here is we identified all of the health resources that were available internally and externally. And we decided that we needed to outline all of our mental health programs and then make categories. So we categorized it by student criteria, what tiers would this actual intervention support or this resource would support. When we decided to discuss tiers, one of the most important things was to ensure that we all had the same language, that we all understood the interventions, the intensity of support, and that we all had the same common language. We also discussed service overviews. And one of the things that we noticed as we were going through this process is that different agencies provided different funding. There were different payment methods, such as some agencies only accept Medicaid, others accept private insurance. Other organizations allow parents to pay via a sliding scale fee. So that was important for us to discuss, because when we have conversations about these services in-house and with parents in the community, they really want to know if the services are accessible to them. Next slide. And then we took time to evaluate our resource map. When we did this evaluation, the one thing we noticed is that we had gaps in services for the tier 2 level. So then we started to brainstorm and think about other ways in which we could provide students who needed the tier 2 support with resources internally and externally. We also identified duplications. So we had multiple agencies that we were utilizing for the same type of support. And then we also realized that there were some agencies that we had listed, but we really didn't use because they weren't as accessible, and they also didn't meet the needs of our students. So we want to also make sure at all times that whatever resources that we select, meets the needs of our current students at this time. So that's why it's important for your resource maps to be updated. Then the next step was to plan on how we would share our resource map. So we decided as a district that it would be important to share it internally with all school members, for all of our staff at the elementary, middle school, and high school, as well as sharing it with our community and how that would occur. So our resource map is on our website. It's provided to all of our staff. They have access to it. And we also provide it to our parents as well. Next slide. And this is an example of our resource map. We have our service providers, what they provide, their service overview, the sites that actually utilize this service. So you'll see Newton High School, Halstead Middle School, Miriam Avenue School. And then we also thought it was important to list the tiered level of intervention intensity that this service provides, what the student criteria is for receiving this service, and any notes. And in that note section, we'll make notations whether or not this source is grant funded, does not accept insurance, does accept insurance if applicable. Next slide. So some of our highlights in creating the resource map is that all of our district team members are now aware of all of the community services that are available. So when we have parents or students that come in and they ask for services, we're able to give them services and show them the resource map and let them know what's available. That way we're also all speaking a common language. I can't emphasize that enough. All stakeholders have access to the resources, and our organization is aware of our district's commitment to mental health. And our teams discuss a road less traveled. So during this time, we also had discussions about what are some other things we can do, kind of thinking outside of the box to provide our students with services. At the elementary and middle school level, we are a walking district. So a lot of our families have a difficult time accessing mental health services. So we decided that we would have a community school at the middle school and the high school where students can receive mental health services within our school building during their lunch periods, study halls, or some of their other support sections so that it's accessible to them. In addition, the Newton High School decided to create a green room, which is a space for students who need counseling or just a place to have a meta moment. Next slide. And some of our lessons learned is to ensure that you do this district-wide and ensure that all team members are present so that it eliminates fragmented information and also fragmentation of services. Consistency with communicating our district mission and vision and goals to community service providers are really important so that we ensure that we're aligned when we have discussions with family members, they understand what we offer, and they understand what our district mission and vision is. Another thing is important to expand partnerships. So even though we have service providers listed right now in our resource map, every year we may find that there are other service providers that can provide us with additional support. And it doesn't necessarily mean just counseling support, but just support in supporting or expanding our tiered intervention resources so that we make sure that we align our resources and services with the current students that are in front of us to ensure that we provide them with every single thing that they need academically and emotionally. Next slide. So I think this brings us to our question and answer session.
Yes, thank you so much, Ms. Dunbar, and also Dr. Zaire for your tremendously helpful information that you've shared. And we do have some time now for questions. And for those of you participating, please feel free to enter your questions into the Q&A box. And we'll try to answer as many questions as we can. But if we don't happen to get to your question, or you think of one after our time is over, please feel free to reach out to us directly. We'll be sharing our contact information at the end. And okay, so let's shift to our first question. So our first question is, in creating a representative school team, do you have any recommendations for whom to include?
So for a school team, can you repeat the question one more time?
So in creating the representative school team in terms of the needs assessment, do you have any recommendations for whom to include?
So in regard to resource map and assessments and needs, it should be your administrators and your school-based support teams.
Dr. Zaire, do you have any additional comments to that you might want to add?
No, I think that's exactly who we would want on those teams. And I would say if you already have a school team, then that makes a natural fit for that team to be doing that. The only thing that I'll add is that if you are doing something where if you're doing the interconnected systems framework, it could be helpful if they're available to have family members or community providers that can join that team as well, so they can directly inform some of the outside of the school services as well.
Thank you. So the next one here is we are in the early stages of our development of comprehensive school mental health. What would you recommend as priorities for needs assessment and resource mapping?
So I guess I'll jump in. I think in some ways it's probably, I kind of think of it the opposite. I think the needs assessment and resource mapping is where we identify our priorities. I think not everybody does it necessarily the exact same way, but as Ms. Dunbar was actually mentioning, I think it's good as a school to first figure out also what our broader goals are. And that can also help focus in a little bit of our needs assessment and resource mapping. But it's in a little way a back and forth process, because we might have specific goals of creating a comprehensive school mental health system. And as we do our needs assessment, we may recognize that there's needs in place that we may not have recognized initially. So that will also help us prioritize what we need to do.
Thank you. Ms. Dunbar, do you have any additional comments?
No, I don't.
Okay. So we have another question. We actually have two that are somewhat similar in this regard, around how often schools should update, or districts, their resource maps. And another person who has a similar question is around evolving resource maps along with student needs and available community resources. How often is the process of needs assessment and resource mapping conducted?
Okay, so we created our resource map in 2019, then we had the pandemic, right, in 2020, and now we're in 2021 to 2022. So one of the ways in which we plan on updating our resource map is based on our universal screener data and seeing what resources are available to the students that we identify as needing a specific need or meet a specific criteria, and seeing if we have enough service providers to help those students. If not, then we look at additional resources, which then in turn would update our resource map.
Thank you. And so there's one last question, and again, feel free if anyone has any additional questions to enter that into the Q&A box. We have a question about the expected time frame for completing needs assessment and resource mapping process.
Well, I gave you an example of our time frame for creating the resource map, which was about 9 hours in total in meeting time. So it depends on how much you spread that out. In regard to needs assessment, maybe Zaire can talk about that portion of it, but it would take about maybe 9 hours, depending on your group, as well as how many individuals you have on your team.
Yes, definitely. I would just add that I think when I would look at it in terms of existing data versus new data. So a little bit of this will depend on your district. So if you are used to looking at your data as well as doing screenings and universal screenings to figure out what the needs are, it's a relatively fast process. So it could be like Ms. Dunbar said, it could be like 9 hours or usually about a week worth of time where we're really assessing our needs. If you're a new school to this whole process, it takes a little bit longer just to set up, have an understanding of what it takes to get those screenings out there, just to even organize the logistics of it. So the first time around often is I would plan for a little bit of extra time just to get it going.
Thank you. And we actually do have one other question, and I'm just going to read this out. I believe Ms. Dunbar emphasized the need for the entire district to be on the same page, using same language and using and understanding the resource mapping framework. Some individual schools have PBS in place and resource professionals in place, but how do you start the process of getting this going for an entire district?
So it starts at the superintendent level. So when we started, I was able to speak with Ann Murphy, and then we introduced our concept to our superintendent, and then the superintendent then helped to lead the resource mapping. So myself and the superintendent. So it really needs to come from leaders in order to get together and ensure that this is a process that they're all invested in.
And I'll just quickly add to that. I think this process in theory can be done at the level of individual schools, but I think wherever possible, it's really, really helpful if we can get the district involved. And the teams that we were referencing earlier too, to facilitate this process, we actually use, include the superintendent as well as district administrators to create a team that's very parallel to the teams at the school level that can help coordinate the broader set of resources across the whole district.
Thanks, both of you. Again, if anyone has any questions, please feel free to include them in the chat or in the Q&A box. And if those are all of the questions for now, we're just going to move along and share some resources.
I actually think there's a few, maybe a few questions in the chat that we might have missed.
Yeah.
Excuse
me, I'm sorry. Yes, we have a few more. So where's the Newton resource map on the Newton website?
So it's under, I'm looking at it right now. So if you go to Newton, our Newton Public School website, home about our district, under news, we have our mental health resource map, and there's a link there in which you can see it.
Okay, and I think that might have answered this next question, but on the Newton School website, where is the resource map that was shared? Where is that located? And maybe
that's where it's shared. Yes.
Okay.
So if you go to Newton Public Schools, you go to home about the district, and under news, you'll see our mental health resource map.
And if I'm not missing any other questions, feel free. We will go on to share some links and resources.
Leisha, sorry to interject. There's one more question.
Okay, certainly.
It says, where can you find an example and samples to obtain ideas on how to develop your own needs assessment?
So just it actually relates to the resources and links here. I believe the first link on here is actually a resource mapping manual. And it actually has a few brief examples in there, but it's also a step-by-step process. So if you're looking to get started and just need a place to start, that would be a good resource. And it looks like some of the other resources here also are examples that can show completed resource maps for different schools.
Thank you. So I hope we're any other questions, I'm sure you can respond directly or at least reach out to the center directly. And also, I just want to mention that the resources will not only be shared in the chat, but slides from this webinar will also be made available to you. And for those of you who are in the early stages of this work, we wanted to include some reflection questions that can help facilitate this process. They include, what mental health needs do you see in your community, district, and/or school? What are the needs of students, families, and school professionals? What available resources are you aware of? What resources may be missing but could be utilized to address identified mental health needs? And how are resources made available to students, parents, families, and staff? And these are just some examples which you can add to with your own teams. And again, the slides that are presented here will be shared and also posted on our MHTTC website. So Kati, I'm going to turn things over to you again now so you can explain the very important evaluative piece of our webinar series.
Thank you, Alicia, and thank you, Dr. Mazahir and Ms. Angela Dunbar for being with us today and to sharing the needs assessment and resource mapping process and resources as well, and explaining, providing examples. I'm sure we will have more questions from our participants. I will share our contact information for our school mental health team as well as myself. You can always email me as well. And on your screen, what you see is our evaluation QR code. If you have a mobile device and you are able to scan over or hover over, you can access our evaluation survey. Our network, the MHTTC network, is funded through SAMHSA, and as part of receiving this funded, we are required to submit data related to the quality of this event. So we ask that you please complete this brief survey regarding the quality of our event today. And I will also share the link to our survey in the chat box as well, if that's easier for you. And as a reminder, we will also email everyone a certificate of completion, those who participate in the webinar today. That will be emailed within a week of this webinar, as well as the link to the post of our slides and the Zoom webinar recording. Next slide, please. On your screen, you will see our contact information. The best way to reach us is through email during this time, and I will also share my email in the chat box in case anyone has any questions. And we want to thank our presenters for being with us today, as well as the school mental health team here at our center. And we also want to thank you for your participation during today's webinar and sharing your ideas and comments with us. We hope that you all have a great rest of your day. And again, if you have any questions, please reach out to us, and we hope that you continue to stay safe and well. Thank you.